Hi, my name is Crystal Wicks. I'm going to continue on where Will Ferrum left off. I'm going to begin with consequences of childhood obesity. Up first, we have the U.S. government expenditure. So, federal funding. In the U.S., childhood obesity costs $14 billion in direct medical costs. The underinsured and the uninsured account for the majority of the cost, be it short or long term needed care. Medications also leave a huge indentation in the federal funding. If these kids are now starting to have adult like issues, then federal funding, if it's not taken care of, you'll have more deaths among children than ever before. Next up, of consequences of childhood obesity, we have heart disease. For most children, atherosclerosis is usually subclinical and progression is slow. In some children, however, the atherosclerotic process progresses more rapidly and is mediated by the same risk factors that are identified in adults. Cardiovascular complications of excess weight in children include dyslipidemia, lipidemia, hypertension, and insulin resistance. In adults, there is an emerging evidence that obesity itself may be the independent risk factor, although the evidence directly linking obesity as an independent risk factor to CVD in children is not yet as strong. So, the more children they start to have within these particular studies, of course, the more research that they can get on it. But they're starting to see, these particular clinical issues in the hospitals and the doctor's offices and are now reporting it. Next up, we have the stroke. Childhood obesity is a rising health concern that has reached epidemic proportions throughout the world. Obese children have a high risk of developing health problems as adults. One of the major health concerns related to childhood obesity is ischemic stroke that occurs due to an obstruction within a blood vessel supplying blood to the brain. Among young adults, it is the leading cause of acquired disability, loss of productive years, life years, and death. Childhood obesity and stroke, as a possible consequence, have become critical public health concerns because of their high impact on individual short term as well as long term health. It's just rising and it's really sad. We next have asthma. Risk of exacerbation in asthma patients can be deadly. The low inhalation oxygen that is able to reach the entire body can be problematic. In addition, early diagnosis of asthma can lead to childhood obesity. Parents tend to prevent children from participating in any activity that can result in an asthma attack. Activities such as basketball, soccer, volleyball, or simply playing tag are not allowed. Parents are more scared that something may happen to their kid, that they may have an asthma attack, and are unable to breathe. So it's not that they just don't want them to play. They have a fear that something may happen. Asthma can be deadly to children. Next up, we have self-image. Self-image tends to decrease greatly. Children dislike the reflection in the mirror. Once that happens, self-value leaves and the eating habits get out of control. So, there's something to kind of keep control of is self-image so that you're aware of it, that you don't get and start to feel, some type of way about your looks. You can fix it before it gets too late or too out of control. Next up, lastly, we have type 2 diabetes. As a child with type 2 diabetes, the result can continue as an adult with type 2 diabetes. An increase of type 2 insulin resistance is on the rise. The progression for children is happening faster than for adults. This was one of the first things in research that they were able to look at as far as what risk or what consequences are coming from childhood obesity. Next up, we have solutions and preventions. We have health education, activeness, universal health care, and psychological help. First up, we're going to talk about health education. Health education, including parents and children, both can hold each other accountable for foods they consume, create shopping lists together, create a chart that would allow everyone in the family household to pick healthy foods they like to eat and keep count of daily caloric intake. These are just some things that we can do to help prevent activeness. Becoming more active and simply being active can prevent or help reverse some health damage. Simple things like going swimming with the family or finding a sport the entire family can participate in can really help that as well. Next, we have universal health care. Universal health care would allow for families to go to the doctor without fear of expensive bills. The system has been widely used in other countries and has been proven a major success. Countries abroad are reporting less instances of serious health issues. They also work on a prevention contingency where doctors receive bonus checks for getting patients off their medications. It is an ease on the federal budget as well as people living longer and healthier lives. Lastly, we have psychological. Receiving therapy for previous trauma can also assist. Sometimes generational trauma can cause obesity for a family, including the adults and children. Listed, you also see that we have citations. I thank you greatly for listening to our presentation, and I hope you enjoy. Have a great day, evening, or night.